have Jeffrey Coe with me. How are you today, Jeffrey?
Very well, how are you?
Very well. Look, I've got a couple of burning questions that I know people watching this video really want to know from someone who's had the experience, built a business at such an early age, of the tender age of 30, I believe, and you currently own 2 practices.
I just turned 30, I might add.
Just turned 30, excellent. And I want to ask these questions on behalf of all of the listeners because we had a lot of feedback and there's certain questions that they wanted to know more about. The first one, can you just tell me a little story on what brought you to starting your own practice?
Well, when I graduated, I worked in private practice for several years, as most graduates do, building up your skills and gaining a bit more world-like experience. You get to the stage where you kind of think there's more out there and you want to have a bit more control over what you do, the type of work you do, the type of patients you see, a bit more control over your future.
And that's what compelled you to start your own?
Yeah, I think that's part of the main reasons that most dental practice owners start practice.
You wanted to be your own boss.
Exactly.
Yeah. Look, I think for a lot of newbies, but also some seasoned professionals out there right now in the dentistry industry or who are dentists, it's no secret it's a tough economy, is it, out there right now? It's
nasty and it's not going to get any better. I mean, ever since the GFC struck, 4 years ago, it's been downhill.
Yeah. And for some dentists, I mean, that's a big thing. It's a tough thing, but you've managed to overcome that using a lot of the strategies that you're going to teach at the symposium event, along with the other experts. But you know, as a dentist, say, like, what could I do right now to help me get more patients and get more customers and patients returning to me? I mean, what are some?
And here's the thing, Bill. As dentists and as business owners, we always think, okay, I need to advertise more. I need to make a bigger, brighter ad and advertise more frequently on Google, on Facebook, have a Twitter account, let's get on LinkedIn, let's do a big ad on Yellow Pages and all the rest of it. Let's do more flyers.
So more marketing.
Do more marketing, let's do all that stuff.
Yeah.
But at the end of the day, you need to change who you are.
Mm-hmm. And is that what this event's about? Changing how I think and who I am?
Exactly. And I always go back to an interview I recall. Bruce Lee, you remember the very famous Kung Fu arts, martial arts expert and very famous movie guy. In one of his interviews, he goes, you must be like water. Water will take the shape of any container that it's filled in. It can be hard, it can be liquid. And so what he's saying is you must be flexible. So you as a person, you must adapt to the environment around you, to the situation, to every single patient that you see. Every patient is different and you must change who you are to best serve them. And that's the essence of building great rapport and building great relationships with your patients and making patients love you and coming back.
Which brings me to the next question, and thanks for sharing that. How can I make patients love me more? I mean, are there techniques to do that?
Just like anything, in dentistry we learn that in order to do a filling, you must do A, B, C, D, E, and then finish it off. Yep. Now, when making patients love you, it's exactly the same. There's a science and there's an art of making patients love you and becoming a patient magnet. And guess what? If you do and follow these simple steps, and these steps are universal. It doesn't matter if you're dealing with a dental patient or a medical patient or anyone else in daily life, it's exactly the same. And if you do these, you will have a very successful practice.
So you mentioned the words magnetic marketing, making clients love me, reducing probably the time that it takes me to get there, and I don't have to do a lot of this heavy marketing or outbound marketing like I used to have to do years ago.
And you know what? It's the most effective because as dentists, patients fall in love with who you are. And so you can spend thousands and thousands of dollars on emails and flyers and letters, but if you're a person who patients are not magnetically attracted to and they don't like who you are, you can be the world's best, most skilled technician and be excellent at what you do and have the most beautiful feelings. But at the end of the day, if they don't like you, they won't come back.
Great. So you're going to teach us how to build that connection effortlessly, how to attract and keep more patients, so not only retain more customers, but attract more without spending all this money on advertising. So clients basically stay with me and love me more. Okay, it's a tough economy. You're going to help me look at ways to get around that without spending a lot of money. You're going to help clients fall in love with me, but, you know, I want to open my own practice, say, and I'm a newbie into the game, or I've been, you know, out, 5-10 years, maybe something like that, and I'm over it. I want to be my own boss.
We all get to that stage. Yeah.
I guess, am I going to learn from someone who's done it themselves? Isn't that
You know, that's the best thing about it. If you want to learn something, you could go and certainly read all the books you like and go watch all the videos you like. But the best way, and how we learn dentistry, is we actually go out there and do it and have someone watching over our shoulder and go, yeah, do this. And when we veer off track, they correct us. So you model and watch someone who's done it before and who's an expert or successful at that.
And your Dick Smiths of this world, your Richard Bransons of this world, I mean, they're very big on it, aren't they? They were all about modelling.
Exactly.
So you've got a proven system and a proven method, and you've proven that, and you also are a public speaker, and to be author as well, I believe, pulling all of this together to make things easy so clients fall in love, they can attract more of the right type of patients, often, which is the right.
Exactly. There's nothing worse than having a practice full of patients who you don't want to treat. It makes life really, really stressful.
So look, we're on limited time here, but can you tell me before we leave, what it's really like to own your own practice? As compared to, say, working as an associate in a practice. How does that feel? What was that transition like for you, and how are you going to help other people do that?
Totally different. The learning curve is extremely steep. Life before practice ownership was, okay, let's go to work, finish at 5 o'clock, 6 o'clock, whatever time you knock off, go home and go play golf, do whatever it is you want to do. And sometimes...
So you had a job?
You had a job. It finishes at the time you finish, you go home and you start your new life.
But now you've created freedom, the ability to have choices, to do the things that you want to do. How does it make you feel?
It's empowering. You have control over where you want to go in your practicing career, and certainly it gives you more freedom, because previously the patients you see are just dribs and drabs of what filters down from up above you, and you want to do all these different things and you want to buy this latest equipment, but you can't because your hands are held. But as a practice owner you can. As a practice owner you have the freedom to hire and find the staff that you work best with.
Okay, so I've got control, but there's a responsibility that comes with that, isn't there? So we're going to wind this video up, and I wanted to say thanks very much for your time. I know it's precious and I know you're in demand, but I just want to appreciate the 5 minutes we've had. What would you say to people that are sitting on the fence right now going, should I come to this symposium or not? Is it for me?
If you're sitting on the fence and you're thinking, I might think about starting my own practice one day, and that's where I was. It was a one day when I have enough skills, one day when I have enough experience, one day when I know how to do that crown prep really well, I might just think about starting my own practice. That one day for most people never comes, and you'll find that you're really old and you just find it as a regret and, I'm too old now, I don't want to ever do it. And don't let that be you. Take action and come to this event. You'll find out if practice ownership is for you or not. Even if you find that it's not, you'll learn so much stuff about how to make your patients love you and become a people and patient magnet that it will make your practicing career so much better.
Okay, so what action should I take right now?
Go ahead and sign up for that course. Go to www.startpractice.com.au, sign up and get there now.
Fantastic. Thanks a lot for your time again. I really appreciate it.
Pleasure. Thank you, Bill.